Welcome to People. I'm Micah Mater. The last couple of weeks, we've brought lots of headlines for Americans in medicine. And with all the changes underway, many are asking how their health care could be impacted. The doctor is in and ready to answer those questions. Welcome, Dr. Jeffrey Sterling. Thanks a lot for coming in.
Thanks as always for having me.
First of all, let's start off with February, which is American Heart Health Month, right?
That's right.
How should we be looking at this? Should we be just, la-di-da-di-da? I think people spend more time worried about whether they have cancer or whether they have risk of heart disease.
Well, learned helplessness is a thing. It's the #1 cause of death in the United States.
Right. Among men and women, right?
That's right. Exactly right. That should always create a sense of urgency. We should know how to protect ourselves from it, know the signs and recognize when it's upon us, and know how to get treatment. It's really a call to action, and it's a good thing that we pay attention to it at least once a year because it stimulates that conversation.
Let's first talk about how to prevent it. How do we do that?
Activity and nutrition. Notice I didn't say diet and exercise.
Right.
If you are mindful about how you live, if you are intentional, garbage in, garbage out, and stay active. The body actually knows to be active as a sign that it's doing well. And in terms of the nutrition part of the conversation, if you are active, your body will use that nutrition to strengthen itself and to do what needs to be done. If you're a couch potato and you take in nutrition, your body tends to store it as fat. So we have to learn how to stay active. We have to learn how to eat well. And that's 80% of the conversation easily.
Yeah, don't be a couch potato and sit and eat potatoes, right? Exactly.
Very good.
Okay, so when you have it or see signs, or what are the signs, how do you do to deal with that?
Well, you know what the signs are because the activities of daily living become more difficult. There are people out there who have congestive heart failure, for example, who literally can't walk across the room without getting short of breath. When they have to sleep at night, they have to sit on pillows, not because of comfort, but to help them breathe.
Really?
It gets that bad. Your heart is just a pump.
Right.
With all due respect to February,
Yeah.
it's not a love organ as much as it is just a pump that flushes blood around the body to provide nutrients
So you
and
know if
oxygen.
something's wrong. You will know it.
Something's wrong because you simply can't act the way in which you would be accustomed to.
Right. Measles. Is that a big deal now?
Yes, and yes. Well, see, there are certain things like measles and tuberculosis that are canaries in a coal mine. When these things pop up and they're not supposed to pop up, it tells you that something is wrong with the public health system. In the example of measles, the problem is that the vaccination rates are starting to come down.
Why?
And, well, because people want to not inject themselves with certain things.
Okay.
So in the United States in 2000, measles was actually declared eradicated from the United States.
I thought it was.
That's back when the vaccination rate was about 97%. And now it's down to about 92%, so you're seeing outbreaks. There's almost 100 people now in West Texas that have gotten this thing, and those types of outbreaks just shouldn't be happening in the United States. And we can predict that they'll continue to pop up in areas. And by the way, this outbreak only occurs in people who either haven't been vaccinated or for whom their vaccine status isn't known. So it's cause and effect.
So you and I, which I know you were vaccinated, I know I was, we'll be good. We're good.
Well, we always speak about these things in terms of risk. Your risk is sufficiently lowered so that you should not expect to get it.
And it could lead to death. We should tell folks.
Oh, very much so. Very much so.
Yeah. So vaccines all around are getting better, worse. I mean, we still need to get COVID vaccines. We still need to get flu vaccines. You say get pneumonia vaccine, RSV, all this other kind of stuff. We should be doing that now.
I tell people, once again, I'm not here to tell people that we should go back to the days of a vaccine mandate. This is a tool in our toolkit. What people should understand about vaccines is that they have been clearly demonstrated. They're the most researched things on the face of the earth in terms of medical interventions. They lower your risk for the worst possible outcomes of diseases. For example, with the influenza and the COVID vaccines, they don't stop somebody from being in your face, coughing on you, and then you getting the disease. People think you aren't supposed to get them if you get the vaccine. No, they lower the risk of you having the worst possible outcomes from them. So you're making a choice to protect yourself or to be exposed to the worst possible scenarios if you don't get vaccinated.
I want to talk about prescriptions, but I also want to talk about quademic. You say we're in a quademic. What is that?
Well, quademic is two things. One is a good example of information that you should have known and that you perhaps would have known if the government didn't have this semi-gag order on it. But quademic actually is meant to point out that there are 4 things happening right now that are happening at high enough levels that we as a community, the public health community, wants you to be concerned about them. The quademic actually says that RSV, COVID, influenza, and norovirus right now are about double the rates that they were this time last year. Somebody in your family is being affected by these things, and you kind of
right now
happenstance like, oh, that's weird. But again, the public health community would have alerted this to you. The CDC and other agencies would have wanted you to know these things, but so much is being tapped down right now, but the public needs to know that this is respiratory season and those 4 illnesses are really out there, so you need to take those protections.
And let's talk about prescriptions, because we need prescriptions for those things, but are people's prescriptions going to hit sky high, or are they going to get taper off, or what's it going to look like? Should we be afraid?
Afraid is the a word
Prices.
that I wouldn't use.
Okay, what word
however,
would you
we
use?
should be on edge.
Okay.
Because the protections that were being negotiated by the government to reduce prices for some of the more expensive things, the most common things, are being taken away. So the free market is being alleged to will correct these things. Bottom line, yes, you're right, but it's too early to say, and I don't want to be an alarmist about these things, but the concern is definitely there, and the expectation should be there that we probably are going to see prices increasing once governmental controls and protections are removed.
What about the infant mortality rate? Better, worse among blacks?
That's actually very depressing. Since the reversal of Roe v. Wade, and the states have taken steps to ban abortion or to restrict abortion to the first 6 weeks, in those states, we've actually seen 500 deaths that would have been avoided had abortion been available as an option. That has resulted in a 5.6% increase in the infant mortality rate. That is a staggering and sudden and direct cause and effect relationship that has occurred. So the more that continues to spread, the worse it's going to be, and the infants are being affected, and it stands to reason that ultimately maternal mortality will be affected in that way as well.
You talked about the changes at the CDC not being able to alert people as they should. What about the FDA? Things changing there as well?
Well, let's go back to that CDC, because they just laid off 10% of their workforce. That's a lot of people. That's 1,300 people, 60% of whom are scientists. The FDA has laid off about 89 people, and that's in the midst of this quademic and so many other things going wrong. These are times where you may expect the numbers to go up. So there's some concern about what can be perceived, what's being interpreted by the public health community as somewhat of a haphazard approach to just cutting without actual long-term analysis of where the needs are, where the opportunities are to reduce staff.
So quickly, how can we help ourselves since we're not being told? How can we help ourselves?
We need to have trusted messengers, we need to stay informed, and we need to act on our suspicions. Don't wait for disease to present. Stay ready so you don't have to get ready. We are what we need in terms of being the best stewards of our own health care.
Empower ourselves.
Very much so.
Don't wait for somebody to
All
tell
the
us.
time. We've been saying this for a long time.
Yeah, exactly. Thank you so much.
Always a
Appreciate it.
pleasure.
You can find Dr. Sterling and wellness resources at thesimcosolution.com.